Great. So we'll get started. So first, thank you everyone for joining today's Civic Pre-Response Web Conference. Today we'll be going over the background and requirements for the RFP entitled Data Vendor for Colorado's All-Payer Claims Database. The purpose of today's webinar is to assist you in preparing your written proposals by providing some background information on the Colorado APCD, on Civic's designation as administrator of the APCD, and on what the APCD looks like today. We'll also provide clarification on Civic's vision for the future of the database, important information that we want bidders and the successful contractors to know, and in turn, how that vision translates into the RFP scope of work requirements. For the scope of work review, we will provide an overview of each of the 3 separate domains of work outlined in the RFP, describe the tasks associated with each domain, and then we'll review some of the questions that we have received in writing pertaining to each task in each domain. For the full list of all questions that we received pertaining to the RFP, as well as the answers to those questions, you can now visit the Civic website and click on the Colorado APCD RFP tab. So the same place where the original RFP was posted. Those questions and answers were posted yesterday afternoon, so they'll be available for you there. Finally, just before we begin, just a few quick housekeeping items. We do have a lot of material to cover today, and we do have a lot of folks joining, so if you could please turn your phones to mute, that will help us remove some of the background noise. If you do have an important question that you feel has not been covered, please use the dialogue chat box in the ReadyTalk application to send us your questions. And if time allows at the end of the webinar, we will answer those questions that we have time for, or we will follow up either on the website, via email, or in some other way. Okay? Slide, please. All right, so let's start with the basics. What is the APCD? So the Colorado All-Payer Claims Database, which we abbreviate to APCD, is a large-scale database that systematically collects and aggregates enrollment, medical claims, dental claims, pharmacy claims, and provider data from commercial payers and public payers who cover more than 1,000 Colorado residents. Based on this definition, the Colorado APCD is currently receiving 48 different data submission streams. And of course, as you know, the number will increase in the coming years as we bring on additional data submitters. We refer to the submission streams as opposed to submitters because certain data submitters have different business lines that operate on different platforms, and so they submit more than one submission. So for example, a single submitter may be sending 3 separate submissions to the APCD, one for each line of business, so that's why we refer to submission streams. The Colorado APCD provides comprehensive cross-payer and cross-setting information on the healthcare costs, quality, and healthcare utilization for all Coloradans. And this cross-payer, cross-setting piece is really crucial and is really what sets the APCD apart from other data sources. Because the APCD captures claims data across all settings of care, so inpatient, outpatient, pharmacy, dental, et cetera, and from all payer sources, we can create a longitudinal profile of an individual to see their care as a continuum. So not just a particular episode of care in one particular setting, but also what came before and after it, even if that person had different insurance providers over time. So the purpose of this contract is to find an experienced firm or firms who can provide professional services to transition and expand the already existing Colorado APCD, including expanding its infrastructure, capacity, and functionality. It's important to note that the Colorado APCD is regarded as a model for APCDs nationally, and is also blazing a trail specifically in regards to the number and types of APCD reports made publicly available, and also the types of specialized non-public reports available to consumers upon request. Therefore, all bidders should be aware that this is a highly visible project which must serve the needs and timelines of a demanding and vibrant data user community. In terms of the format of this RFP, because we do have a fairly broad scope that requires different skill sets, we have divided the required tasks into 3 separate domains of work. And those are data management, access and reporting, and then the consumer website. We'll review these 3 domains in greater detail during the webinar, but for now you can think of these as separate mini RFPs, and Civic really does encourage bidders to only respond to those domains for which you are particularly qualified. Civic will be reviewing responses to each of the domains as separate standalone solutions. And as a result, Civic may award 0, 1, 2, or 3 contracts under this RFP for the 3 separate domains of work. Civic may also select a contractor for fewer domains than to which you responded. So for example, if your firm responds to all 3 domains, Civic may choose to award you the contract only for domain 1, data management. So here you see the procurement timeline, and we just wanted to quickly go over some of these dates. So first, as I hope most of you are aware of by now, we have extended the deadline for proposals to give you an additional week to formulate your responses. So we've pushed the deadline out to Friday, October 2nd, which is 2 weeks from tomorrow. Please remember that the proposal submission includes 2 separate steps. So the first step is mailing or hand delivering the proposal to Civic. And then the second step is emailing the entire proposal to datavendorrfp@civic.org. The emailed version should be a single file, including both the technical and cost proposal combined. Both of those steps, so the hand-delivered or mailed and then the emailed version, both need to be received by 5 p.m. Mountain Time on October 2nd. After the proposal deadline, Civic will begin evaluating each proposal, and we hope to have on-site demonstrations in Denver in early December. The initial contract period for any contract awarded will begin approximately July 1st, 2016, and will extend for 3 years through June 30th, 2019. Now, although we haven't put anything on the slide about the budget, we did receive many questions. So just to answer that, Civic does not have a set budget for the work outlined in the RFP, but Civic is absolutely looking for the best combination of price, value, and utility. We strongly encourage everyone to price competitively and propose the best value. Okay, slide please. So I'm going to turn the floor over to Jonathan Matthews, Civic's Vice President for Research and Compliance, and Jonathan will provide some background on Civic and the APCD.
Thank you, Tanya, and thank you to everyone for joining us this morning. My goal here is to provide folks with a little background on Civic and the Colorado APCD, give you a sense of current capabilities, and hopefully that'll be useful in informing your responses to the RFP. So first, who is Civic? We are an independent nonprofit organization. We pride ourselves on our objectiveness and nonpartisan stance on most issues. Civic was born out of the recommendations of the Colorado Blue Ribbon Commission on Healthcare Reform, which were released back in 2008. There was a long list of recommendations that came out of the Blue Ribbon Commission process. 2 that are particularly relevant here. One was to create an entity that would coordinate healthcare reform and change efforts around the state of Colorado, and Civic was born out of that recommendation. The second was to create an all-payer claims database for the state of Colorado, and we're all here. The goals of Civic. Could everybody please mute their lines? We're getting some telephone ringing in the background. Thank you very much. Our goals are mainly related to the triple aim, and our focus is on the state of Colorado, although we do work on projects with partners nationally. The triple aim will be familiar to most: better health, better care, and lower cost. And our own twist on that is the +1 of greater transparency and access to data. Our areas of focus include all-payer claims database and other data sources to inform the healthcare policy transformation process in Colorado. We're also very active in the areas of payment reform, specifically episode of care analysis and reference pricing. We're also very active in the area of delivery system redesign, specifically focused on palliative care and better coordination of care transitions. The All-Payer Claims Database, again, a recommendation of the 208 Commission, was established by legislation passed in 2010. Civic serves as the administrator of the APCD by determination of the Executive Director of the Department of Healthcare Policy and Financing here in Colorado. That makes us pretty unique in the APCD world, where most APCDs are housed in and managed by state agencies. Our goal is to have comprehensive claims information from all public and private payers. We have currently Medicare fee-for-service, Advantage, and supplemental plans. We have Medicaid, thanks to the Department of Healthcare Policy and Financing, and recently an administrative rule change was passed that will start the flow of self-funded plan data to go along with our fully insured commercial plan data. We anticipate having data for 90% of the insured population in Colorado about a year from now. Public reporting is available on comedprice.org. That little heat map graphic you see is an example of the type of mapping capability that's available through the website. We also have the ability to release custom reports and data sets, de-identified, limited, as well as patient-identifiable information to support permissible purposes under HIPAA. Those are research, public health, and payment, treatment, and operations. Our sustainability model, which has been evolving since the APCD got started in 2012, relies on a combination of revenues, cost recovery fees for providing data to support various initiatives, and foundation and research grants. Over 50 articles and publications have used our data. There's a list or a success gallery available through our website that gives you a sense of the kind of entities that have requested or received APCD data and the uses to which they've put that information. A wide variety of stakeholders have reached out to us for either custom reports or analytic data sets to support their own initiatives, to identify opportunities to bend the cost curve and improve care within the state of Colorado. We've also satisfied more than 40 requests through our data release process, and again, which is fully HIPAA compliant. The public website, I hope you've all had opportunity to take a look at it, and if you haven't, I would encourage you to do so. The website's been up since the fall of 2012. We pride ourselves on the breadth and depth of the interactive reports available through the website. You can see information in both map and tabular views. Mainly, we highlight variation in utilization and spending across the state, but we also provide a lot of additional information based on analysis of the claims data, and we're trying to find new ways to leverage the power of that information each and every day. You can see compared to expected values on spending, which reflect risk adjustment and underlying disease burden in various parts of the state. The usual categories are broken out, and information on utilization and spending is available within inpatient, outpatient, and the other categories you see listed there. We have readmissions measures generated a couple of different ways. Rates per thousand population, broken down by service line. We also publish information on potentially preventable hospital readmissions. We have information broken out by illness burden, provider density, or access to PCP physicians. We have incidence and cost to treat chronic disease. Currently, that's limited to asthma and diabetes. Until we got Medicare fee-for-service claims data, we limited our public reporting to people age 64 and younger, or analysis of data for that cohort of people. Now that we are adding Medicare fee-for-service data to the public website, we've opened it up to 65 and older, and we've added depression and hypertension to our list of chronic diseases for which you can see information on costs, incidence, prevalence, and cost to treat people who have those conditions. Data is stratified by age group and gender and grouped geographically by county 3-digit zip and health statistics region. Those health statistics regions are aggregations of counties developed by the Colorado Department of Public Health and Environment based on a methodology developed by the department. The underlying data for all of the reports available through comedprice.org is available for download in Excel format. A little bit more on the data release process. We divide our data release offerings into 3 categories. Custom reports are something that could basically be on our website but aren't because we haven't thought of it or haven't had time to do it yet. De-identified data sets fall into that category because neither one of those offerings include PHI and therefore fall outside of HIPAA. We also make limited data sets available, which include 5-digit zip code, detailed dates related to an individual. Those are also available through our data release process. And in certain limited cases, patient identity information can be provided to qualified data requesters to serve research and other purposes. Obviously, it's very important to ensure HIPAA compliance as well as FTC DOJ antitrust safety zone compliance for limited data sets and patient identifiable information. Some potentially transformative uses, I mentioned these just a second ago, but under payment reform, we've developed 12 of the Prometheus open source bundles, acute care episodes, if you will, along with some very sophisticated dashboard reporting and drill down capabilities for our state Medicaid agency, the Department of Healthcare Policy and Financing. We're also developing the capability to look at specialty care referral patterns for primary care physician practices so that they can better understand the implications of their downstream referrals. On delivery system redesign, again, we have a palliative care initiative in place with a number of other stakeholders in the state of Colorado. We're trying to use APD data to demonstrate the value and utility of claims information to show the return on investment for greater access to and reimbursement for palliative care services. Civic is also the managing partner of Healthy Transitions Colorado, which includes a large number of stakeholders around the state working to improve care transitions and to reduce the number of hospitalizations, rehospitalizations, ER/ED utilization rates, and observation stay rates for people post-hospital discharge. We are also very active in a number of other efforts around the state, looking at integrated care. Of course, the State Innovation Model, or SIM grant, awarded to Colorado earlier this year, is focused on integration of behavioral and physical health services and providing access to integrated services for 80% of the Colorado population under innovative payment reform designs over the next 4 years. We're working closely with the Colorado Extension System to create feedback to physicians. Again, the idea is to leverage the power of the APCD data in ways that help physicians better understand their relative performance and how they might make changes in their practice patterns to improve care and reduce costs. We've also been very active in a total cost of care measurement initiative along with several other states across the country to implement the Health Partners NQF endorsed total cost of care and resource use measure set, again with the goal of reporting that information back to primary care physician groups in a way that's actionable and helps them better understand comparative performance. Again, I just mentioned total cost of care for physician groups. We've been working under funding from the Robert Wood Johnson Foundation for 18 months. We have funding for another 18 months. This work is being led by the Network for Regional Healthcare Improvement. Current phase 1 included 5 participants, and we've added Maryland and Utah to the mix over the next 18 months. Again, the goal is to put actionable information in the hands of practices that allows them to better understand their comparative performance and identify opportunities to reduce costs and better coordinate care.
All right. Okay, so thank you, Jonathan. So slide, please. So that was a quick background on the Colorado APCD. So now we'll turn back to this particular RFP. So again, the RFP has been divided into 3 separate domains of work, all of which are outlined on this slide. So just to quickly go through them. Domain 1 is data management, and that includes migrating the existing data from the current data vendors for both platforms. Oh, that phone call again. If someone could please mute their phone. Sounds like someone's just on hold. Everybody just please mute their lines or
maybe asking people not to.
Oh, hold on, Tanya, I'm going to mute all and then unmute you.
Okay.
The conference has been muted.
Okay, Tanya, can you speak, please?
Yes.
Great.
Yes.
Okay, so I have muted everybody except you, Tanya, so we should be good to go.
All right. Sorry about that, folks. All right. So domain 1 is data management and includes migrating the existing data from the current data vendor to the new proposed platform, secure data collection and aggregation, claims editing and business processing, and warehousing and value-added components. So that's all domain 1. Domain 2 is access and reporting. This domain includes all tasks related to developing and maintaining role-based access to the fully processed APCD data. And domain 3 includes the design, deployment, and hosting of a public-facing Colorado APCD consumer website. Slide, please. So before we go into the specifics of each domain and task, we did want to provide some additional information that we feel is important for bidders to keep in mind as you write your proposals. So first, Civic is not looking for bidders to replicate or lift and drop the current model. We received many questions asking about what is currently being done, what the processing times are, what the current methodologies being used are. And frankly, apart from what we're sharing with you today and what you'll find in the questions and answers posted on the website, Civic does not feel that these questions are pertinent to this RFP. Instead, we're really focusing more on the future vision for the Colorado APCD and looking for bidders to propose what you think would bring the most value. Towards that end, Civic is open to all solutions, methodologies, and approaches that leverage recent technologies and industry standards and provide the biggest bang for the buck. You should not feel constrained by what is currently being done. Civic really wants to hear about the value add that you can bring and the approach that you would propose. Slide, please. We also wanted to provide some of the overarching expectations and ground rules for any successful contractor. To go over just a few that are on this slide. So first, you'll notice that the RFP places a high degree of emphasis on for contractors to keep stakeholders continuously engaged. Please just keep in mind that these stakeholders will differ depending on the domain to which you are responding. So for example, if you're responding to domain 1, the stakeholders will be the data submitters. Domain 2, stakeholders will include the Civic staff and external stakeholder users of the APCD access and reporting system. And of course, domain 3, the website, are public users of the website. Second, the Colorado APCD operates under both state rules and federal data use agreements, including CMS. This is especially important to understand if your firm has only ever operated in the commercial space. And by the way, all of these applicable rules are referenced in the RFP and in the Q&A. So what does it mean? So for example, let's say you're chosen as the contractor for domain 1 and you realize that the data you're getting from data submitters is not sufficient to achieve excellent data quality. Well, you can't just let Civic know and expect them to automatically or very quickly change the data submission guide specifications because, of course, these are governed by the Colorado APCD rules. Nevertheless, you will be responsible for data quality and the performance of your firm will be highly visible. So just please be aware that there are many rules governing the Colorado APCD. You will be expected to comply with their terms and work within their parameters, and all eyes will be on you. So the third thing we just wanted to highlight is that any selected contractor will be required to provide detailed documentation for all methodologies and tools that you propose and implement. Civic is not looking for a black box approach here, where methods are considered proprietary and therefore not disclosed. and Civic is particularly interested in bidders who propose standardized measures which allow for comparisons between other states and regions. Finally, Civic is looking for a contractor who is skilled in working with other vendors and across company lines. Given that there may be several handoffs in data, especially if Civic goes with 3 separate vendors, your firm must be flexible, know how to work collaboratively with others, and must be responsive. So that means everything from responding to emails quickly, not being late to meetings, and also not nickel and diming whenever changes are needed. Okay. So now that we've gone over the ground rules, let's go through each of the domains. So we'll start with Domain 1, Data Management. As you can see on this slide, there are 3 tasks associated with that. That's Task 1A, Transition and Planning, Task 1B, Data Collection and Aggregation, and Task 1C, Data Warehousing and Value Adds. Anyone that's bidding on Domain 1 must demonstrate the capacity to perform all required tasks. So your response, if you're responding to Domain 1, has to respond to all 3 tasks. Okay? Slide, please. So Task 1A, Transition and Planning. So here Civic is looking for the contractor to work with the existing data vendor to migrate the Colorado APCD data and to take over data collection, aggregation, processing, and warehousing. Now, as part of this task, the contractor must provide detailed documentation on how they plan to implement the transition by the dates in the RFP and with minimal disruption to data submitters and Civic processes. So the documentation that we're referring to includes 4 separate components. The first is the transition plan, and that's how the contractor plans to implement the data transition between the old vendor and themselves. The project plan, which is the implementation and management of all Domain 1 activities. So that includes protocols for data encryption and security, staffing, project communications, etc. The third is the business rules document, and that includes the methodologies and business rules that you propose to apply to the Colorado APCD data. Again, Civic is looking for detailed documentation here that's transparent and not a black box. And finally, the data quality plan. This is the plan for ensuring that all data uploaded to the data warehouse is as complete and accurate as possible, and that any and all deficiencies are documented and communicated to Civic. And what's important to remember here is that Civic is looking for a proactive approach to data quality. Civic staff and the Civic users of the data should not be finding all of the data errors themselves. Instead, the contractor should have at least 1 project team member fully dedicated to looking for data issues, bringing them to Civic's attention, and proposing solutions. Civic takes data quality very, very seriously, and this is therefore one of the most important requirements in Domain 1. Slide, please. So this slide just shows some of the questions that we received pertaining to Task 1 activities. So I'll just go through these 4, and again, all of the answers are provided on the Civic website as of yesterday. So the question we received was, is the existing vendor obligated contractually to coordinate with the awardee and provide transition support? So the answer is yes. The existing data vendor is contractually obligated to coordinate with Civic and any new contractor, and this includes providing all information and assistance necessary to ensure the smooth transition of data and services. Will existing rules and methodologies be available? The existing vendor will work with any new contractor to explain the logic and data processes that are currently being used to manage the Colorado APCD data. However, their business rules will not be available to the new contractor other than the standards contained in the data submission guide. Okay. As part of the transition, the new contractor, you'll receive copies of the raw data received from data submitters, a list of all data intake checks performed by the existing vendor, and copies of all fully processed data with all value-added components produced by the existing vendor. And then Civic is looking for a parallel processing. And as part of that, the new contractor will be expected to run their own methodologies and business rules against the raw data received from submitters, and then prepare a monthly report comparing how their data intake checks and fully processed data compare against that of the existing data vendor. So that's what we mean by parallel processing. Okay. The third question, what of the Colorado APCD needs to be migrated and how should legacy data be kept? So the data that needs to be migrated includes all of the Colorado APCD data from 2009 to a mutually agreed upon cutoff date, which will be sometime in mid-2016. So approximately 7 years of data will be migrated. This includes both the raw unprocessed data as it was received from data submitters, as well as the fully processed data with all value-added components as run by the current vendor. Okay. The new contractor must retain this, what we call legacy information, and store it separately within the data warehouse. The preferred approach is to store a copy of the legacy data in its current format to ensure that reports and analysis can be replicated. However, if you can ensure that all the content can be replicated and reconciled from a new format, then that's fine too. Okay. And then finally, the fourth question was, does a new contractor have to use the same methodologies? And again, the answer is no. Civic is really looking for you to propose your own methodologies, which are transparent. All right. Task 1B is data collection and aggregation. This is the second task of Domain 1, and here Civic is looking for a contractor to be responsible for all front-end data collection and aggregation. This includes executing a monthly extract, transform, and load process, so loading all of the data, including all of the value-added components, into the data warehouse within 30 calendar days of receipt from data submitters, and we realize that's aggressive. Contractors who are unable to commit to this 30-day turnaround, you can still respond to the RFP. We just ask that you clearly state that you are unable to meet this 30-day requirement and that you provide the deadline that you would be able to commit to as part of your proposal response. So just a few other things that Civic is looking for in Task 1B. Contractors should be flexible enough to make changes to their ETL process based on rule changes or approved waiver requests. So for example, if a certain submitter has been approved to report a certain data element less frequently than the required threshold in the data submission guide, the contractor's ETL process must be able to accommodate this variation. And please keep in mind that there are hundreds of data elements and up to 70 different submission streams, so the ETL process really must be agile. The second thing to point out is that contractors will be serving as the CMS-approved Medicare custodian and the QECP data custodian. So this is, again, some of that government and regulatory involvement we were referring to earlier, and the contractor must be able to comply with all relevant requirements and regulations. If you haven't already, we encourage you to review the requirements in the RFP and also the additional information and links that we provided in the question and answer yesterday. And finally, contractors must provide ongoing technical assistance and support to data submitters. This is really important. So this includes facilitating at least 6 data submitter calls annually. There needs to be a designated individual to serve as data submitters' primary point of contact, and that person needs to be available during regular business hours, 9 a.m. to 5 p.m. Mountain Time, Monday through Friday, and then participating in additional one-on-one calls for onboarding new submitters and ad hoc technical questions. Okay. So again, this slide shows 2 of the questions we received pertaining to Task 1B. So what is meant by the requirement to receive and load non-claims data feeds? We got this a lot. So in the near term, Civic expects to add additional non-claims data sources to the APCD. Now, although these data sources have not yet been determined, they may include things like clinical data from the Health Information Exchange, consumer data, vital statistics, population health, social determinants of health, data on the uninsured, etc. So bidders should propose the types of data that you would be able to integrate for reporting purposes, as well as your approach for integration. And for Domain 1, these non-claims data feeds can be loaded as separate tables and don't necessarily need to be integrated into the data warehouse directly. And again, you can find some more information in the question and answers that were posted yesterday. And the second question we got was about what is expected as part of the onboarding process. So the contractor will be required to support onboarding new data submitters as we identify them and add them to the Colorado APCD, and that includes assisting submitters in producing and delivering files that conform to the data submission guide specs, processing test data sets, producing an exception report based on the processed test data sets, working with submitters to make the appropriate adjustments or drafting the appropriate waiver requests, and then receiving and processing historic data as needed. Okay. All right. Task 1C is data warehousing and value add. This is the third and final task of Domain 1. And this task includes providing data warehouse services as well as adding all value-added components to the Colorado APCD data. And those value-added components that we have identified in the RFP as requirements include the algorithms for creating unique patient and unique healthcare provider identifiers, creating distinct condition categories and episodes of care, patient-level risk scores, attributing patients to primary care providers, and then the ability to generate indicator flags that allow analysts to simply use the flag rather than spend time identifying a subset of claims, members, or providers that they want to perform research on each time. If you have other value-added services that we didn't identify in the RFP but that you think will bring value, we encourage you to include these in your response. The full requirements, again, are spelled out in the RFP, but we have just included some of the most important aspects of Task 1C here on this slide. Direct patient identifiers, so things like names, street addresses, city, social security numbers, those must be separated from the rest of the Colorado APCD data after assigning the master patient identifier, and they must be encrypted and stored on a separate, highly secured server. So separate server. Okay. The value adds that we've just mentioned are included in what we refer to as the fully processed data, and therefore they must also be available 30 days after receipt of data from data submitters. We got that question a few times also. And finally, and I know I keep coming back to this, but the contractor must implement robust and proactive post-data load quality checks. Again, this includes a dedicated full-time analyst who's responsible for mining the data, identifying, communicating, and resolving all data errors and anomalies, and performing any additional data quality investigations as directed by Civic. Great. So some of the questions we received. One of the questions was regarding the requirement for the master patient and master provider indices to employ an open standards-based architecture with an API or web services framework. So here, Civic is seeking the ability to manage and enhance the master patient and master provider indices by integrating them with other data sources, such as, so the National Plan and Provider Enumeration System would be an example, so NPES. And we'd want to do this to achieve the greatest degree of MPI resolution. In addition, if a statewide MPI is created in the future, so for example, one that is shared by the Health Information Exchanges, Civic, or other state agencies, Civic wants the ability to periodically interface with these statewide indices. Okay, so that's what we mean by that requirement. And again, you can find a little more detail in the Q&A. What will be the source of information for capitation and incentive payments? This is one of the required data sets to Civic. This information will either be sent directly by the payers in their claims files. So for example, some payers currently include fee-for-service equivalents for alternative payment models, or the information will be provided in a supplemental file from either the payer or an additional data source, but the information will be provided to you. And third, will it be acceptable for the domain 1 vendor to send a feed of the data to the access and reporting vendor, so domain 2 vendor each month, rather than provide an environment in which the domain 2 vendor can run their application? The answer is yes. A monthly data feed is fine. Okay. Do any of the Civic team members have anything to add to the requirements of domain 1 before I proceed to domain 2?
No, not at this time. I think you've pretty well covered the highlights.
Great. Okay, so domain 2, again, is broken up into 3 tasks. And again, anyone bidding on this domain must demonstrate the capacity to perform all 3, and you should include your approach to all 3 in your response. Task 2A, planning, design, and demonstration. Task 2B, implementation and maintenance. And task 2C, data release support. Okay, so here we've combined tasks 2A and 2B. And these tasks involve developing, demonstrating, and implementing the role-based data access solution. So this solution will sit on top of the APCD data warehouse and will have 2 primary portals. The first portal is the Civic Administrative Portal, which allows designated Civic users the ability to view all of the Colorado APCD data, create and save custom queries and reports based on their defined filters and selection criteria. And we're also looking for the ability to push these custom reports and data sets out to approved external stakeholders via the External Stakeholder Review Portal, which is the second portal. So that second portal, the External Stakeholder Review Portal, is where data customers, subscribers, researchers, commercial entities, so non-Civic users, can log in to view and retrieve the data products to which they have been granted access. Okay? So these data products can include things like one-time or subscription-based access to certain reports, data sets, dashboards, you name it. The External Stakeholder Review Portal also needs to have a sales component, which allows prospective customers the ability to view a sample of the Colorado data and reports, obtain, complete, and submit a web-based application, and then pay for the data that they have received access to. Okay? Civic's goal with this domain in general is to provide the most flexible and dynamic access to the Colorado APCD data to as many different users and user groups as possible. So please keep that in mind when writing your responses. All right, so here are some of the questions we've received regarding domain 2A and 2B. There were a lot of questions regarding what we mean by integration with Salesforce.com. So Civic is looking for the contractor to integrate existing account objects and associated contacts into the External Stakeholder Review Portal. So the contractor should have the ability to convert these accounts license via an API into account-specific portals so that the associated contacts can log in, view, and interact with their data requests. Okay? And beyond integrating with Salesforce, there is no expectation for the vendor to provide any additional support to Civic in the use and maintenance of Salesforce.com. Again, Civic already holds the license. We're just looking for you to integrate it into the access and reporting system to convert leads. The second question was regarding the requirement to consume additional data via custom files. And I think the best way to answer this is to provide an example of the intended goal. So, for example, a request may come in via the External Stakeholder Review Portal for a custom data set from the data warehouse. However, Civic may want to provide an additional custom data file, so let's say a CSV file, to be integrated with that request for a combined analysis. So the contractor has to be able to take in the Civic-provided CSV file and provide it to stakeholders via this External Stakeholder Review Portal. Okay, so that's what we mean by consuming additional data. The third question is what was meant by the requirement to allow multiple redundant read-only copies of core data. So again, with an example, an external stakeholder subscribes to a data product. When they subscribe to a data product, the product can either be read-only or interactive reports, spreadsheet, etc. So these data products can also be housed on either the external stakeholder review portal or on an SFTP site. And as a result, there may be multiple copies of data residing on separate access mechanisms. Okay. And finally, the purpose of demonstrating the access and reporting system to Civic is to demonstrate its interface, capacity, and functionality before it's fully implemented. The demonstration will happen in February 2017, and the contractor should be able to make changes to the system based on feedback received. Okay, slide please. Task 2C, data release support. This is the third and final task of Domain 2. And with this task, Civic is looking to maintain a record of what has been reported previously, as well as work with the new contractor to develop a new suite of reports. So therefore, the Domain 2 vendor must provide continuity across the transition. Reports based on legacy data must be accessible by Civic staff as needed on a self-serve basis. With respect to designing standard reports, and I'm talking about standard reports here, the contractor will work with Civic to develop a minimum of 50 distinct standard reports which meet the needs of 10 different market segments. So approximately 5 reports for each market segment, and you can see a list of the market segments in the RFP. The standard reports will be available to data customers on request, and the contractor will be responsible for filling a minimum of 300 approved standard report requests each year. Each request will be based on one of the already developed distinct standard reports, just filtered and sliced a different way. Okay, so 50 reports, just filtered, sliced a different way to produce a total of 300 over the course of the year. The custom reports, on the other hand, will not be based on one of the already developed standard reports. Okay, so that will take more resources and time. With Task 2C in general, Civic is seeking to leverage the contractor's knowledge and expertise with analyzing and manipulating multi-payer healthcare claims data. We're looking for a contractor with considerable insight and experience with claims data, healthcare trends, insurance data, health system data, and towards that end, Civic is looking for robust, rigorous, and automated as well as manual analytic processes. Okay, so really looking to kind of harness your experience here. Some of the questions that we received regarding Task 2C. How will customers request and receive reports? Again, reports will be requested, paid for, approved, and transmitted all via the external stakeholder review portal. We're trying to automate the process as much as possible. Will the 300 report requests be delivered through a static report, or will they need to be dynamic reports? The answer is that the contractor should have the capacity to produce both static and dynamic reports and provide these, to customers via the external stakeholder review portal. Who's responsible for developing the reporting requirements, approving the design, and testing the functionality? The Domain 2 contractor. They'll work with Civic to design and develop all standardized report offerings. The contractor will be responsible for testing all functionality, fulfilling the report requests for Civic review, and delivering the reports to each customer via the external stakeholder review portal. Okay. Do any of the Civic team members have anything to add to Domain 2?
No, but if anybody has specific questions, please, via chat, please feel free to go ahead and ask them, and we'll see if we can cover some of those if time allows at the end.
Okay, great. So Domain 3, this is the third and final domain. There are 2 tasks here. The requirements gathering and design is Task 3A, and then the website deployment and maintenance is Task 3B. Slide, please. So Task 3A involved the design and deployment of the secure consumer-facing APCD website for members of the public with varying health literacy levels. The website must be optimized for mobile devices, and what we mean by that is that the design has to be compatible with the dimensions of a mobile phone or tablet across all operating systems, so iOS, Android, BlackBerry, and Windows Mobile. The website must also not require additional license fees for ongoing operation, maintenance, or updates. The current vendor will continue to host the existing website until approximately mid-May of 2017, at which point the new contractor will be responsible for standing up and hosting the new redesigned site. So Civic does envision a redesign and relaunch of a new website that meets the evolving needs of the organization as well as the Colorado healthcare data user community. Although contractors can leverage the existing interfaces if they choose, we are looking for a redesign. Civic expects that the Domain 3 contractor will work collaboratively with Civic and its stakeholders to achieve the reporting goals. So this includes conducting visioning sessions with Civic and its stakeholders, as well as facilitating consumer focus groups to make sure that the new website is easy to use and has an accessible design, and also can present complex materials in a simple format. And finally, Civic is looking for a contractor to propose a strategy for marketing the website to certain target audiences. So this includes a strategy for search engine optimization, the tracking of website traffic, and opportunities to collaborate with other similar websites that may offer synergies. Okay, so that's the marketing services that the RFP refers to. Okay, slide please. And some of the questions. So again, Civic is looking for a redesign and relaunch of a new website that meets the evolving needs of the organization. And then the responsibility for website enhancements. I think that there was a list of the website enhancements that are planned for 2015 and 2016 on page 9 of the RFP, and we got some questions about, who's responsible for that. So Civic has been working with the existing data vendor to define, plan for, and implement those website enhancements. But given that the new contracts will begin on July 2016, the new contractors will become key collaborators in these discussions. And so you will need to ensure that this additional price and quality information is made available via the new website. That also means that the Domain 1 and Domain 2 contractors will be responsible for facilitating measurement of these additional procedures and services. So really those enhancements pertain to all 3 domains. And again, Civic is open to you proposing additional value-added components and enhancements beyond what we've laid out in the RFP. So that was it for Domain 3. We didn't get that many questions on Domain 3. So I know I just went over a lot of information. There are a number of planning, documentation, and activity milestones in the contract. So these are just a few of the key activities that you should have in mind. July 2016, again, that's the contract start date. November 2016, that's when the legacy data, so the 2009 through kind of mid-2016 data needs to be uploaded to the new data warehouse. By March of 2017, the reprocessed data needs to be loaded into Domain 2's access and reporting system. Also in March, the new data manager will begin intaking files directly from data submitters. And in March 2017, the reprocessed data is available in the access and reporting system. April of 2017, the standard and custom reports are available based on the reprocessed data. Again, that's Domain 2. May of 2017, that's when the new redesigned website is launched. That's Domain 3. And then the first refresh of the consumer website will occur in September 2017, and that will be a quarterly refresh. Slide, please. So finally, we just wanted to address some of the kind of general questions, formatting questions we received. In regards to page limits, please follow the page limits outlined in the RFP. You can include report examples and other appendices outside of the page limit restrictions, but just note that those additional pieces may not be considered as part of the evaluation process. And also just please put any appendices or additional reports at the end of the technical proposal. Bidders should submit one executive summary for the entire proposal and include your detailed approaches for each domain in the appropriate narrative response to domain section. If you are bidding on more than one domain, please respond to each domain separately and sequentially. Again, they'll be looked at as standalone components, although of course we will take into consideration efficiencies that would arise if you are to be selected for more than one domain. So again, separately and sequentially respond to each one, including a separate understanding of requirements, proposed strategy, work plan, and staffing plan for each. The staffing plan and the work plan do count towards the 10-page limit for each domain. Domain responses cannot exceed 10 pages each. We received a question saying, you know, if we're responding to domain 1 and 2 and our domain 1 response is 5 pages, can domain 2 be 15? And the answer is no. Each one has a 10-page limit, to be fair. Okay. If you are proposing a pricing model that is not based on hourly rates, and this is important, there is no need to provide a project staffing worksheet, which is worksheet B. If it's not based on hourly rates, go ahead and just provide worksheet C, cost proposal, and just include all itemized costs in the other costs column and then explain your costs in the budget narrative. Please also include a detailed description of the assigned staff, including their percent effort in the budget narrative, just because we won't be seeing your project staffing worksheet. And then in regards to offshore staff, contractors must ensure that all their technical resources are available for at least 8 hours per workday during normal business hours Mountain Time. And contractors must also ensure that technical resources located outside of the U.S. have the capacity and resources to both effectively participate in client-facing team meetings and that they can provide clearly written emails and requirements documents. But apart from that, there are no further restrictions. Okay, so that's all we have today. We do look forward to your submissions. Again, if anybody has any questions that they feel haven't been answered, you can go ahead and enter them into the dialog box in ReadyTalk. And Anna and Civic Team, I don't know if you've received any that you want to answer now or if we'll follow up on the website.
Yeah, we've received a couple. So the first one is, will Civic provide the infrastructure? Is that part of the bid as well? And I believe the response here is that it will be part of the bid. We're not proposing a specific infrastructure other than those components that were identified in the RFP. The other one, another question was specifically in response to question 17, and then we'll also provide updates to the questions that are posted for these additional ones. But one that was asked in response to question 17, you state that Civic must have ongoing role-based access to all levels of the data warehouse. Is this the data warehouse maintained by Domain 2? In particular, if the domain vendor is sending a monthly data feed to Domain 2. If they are separate vendors, it will be access to both the warehouses within Domain 1 as well as Domain 2. Okay? Clarification on answer to question 48. It appears that our formatted document that's out there did some cutting off of one of the responses. The date that's on question 48 is actually June of 2017. But we'll go ahead and review the document to ensure that there are no other formatting issues. And I see several more that just popped up here. So Okay, so here's another one. For vendors responding to all 3 domains, we are wondering where we can present our overall project management approach and to discuss the efficiencies gained by awarding one contract. Tanya, can you address that one?
Sure. You can write about that in your executive summary, and you can also include that in your budget narrative. So remember again that you're submitting your technical proposal and your cost proposal together, and they'll be reviewed together. So you can mention those efficiencies in the budget narrative. If you have room, you can certainly speak to them within the narrative approaches to each domain section. And certainly I would include in each narrative approach to each domain that you are bidding on all 3, and therefore there will be efficiencies just because they might be evaluated separately at first anyway. So there are several places where you can include that: the exec summary, the narrative responses, and the budget narrative.
Another question is, I believe one of the other questions actually refers to this one, so we won't readdress it. We will have the presentation posted to the site, so please look for it there sometime later today. Another question is, can you clarify any vendor hosting APCD data will need to meet the QECP security requirements? So though QECP certification is mentioned in Domain 1, any vendor hosting data will need to meet the security requirements for QECP. Tanya, do you want to answer that one, or we may need to just do a little bit of research and respond back to that later?
Yes, we can do some research and respond back to that later. We did provide more clarification regarding QECP requirements in the question and answers. I'm just trying to find the question here so that I can refer you to the correct. It's question 48, but we'll do a little bit more research and see if we can provide some further clarification on that requirement.
Okay, no other questions.
All right. Well, thank you everyone for joining. We look forward to your submissions. And like Anna said, we will post the webinar on the website, and we'll see what we can provide by way of additional clarification on the QECP requirements. Thank you.